So colon cancers are one of the cancers of the gastrointestinal tract. It is the most dangerous and affects a lot of people worldwide. It's fairly deadly. The most dangerous of the GI cancers. Different risk factors do exist for colorectal cancers. Age. We see these more in older individuals, specifically males. People with family history, there are certain genes that can be inherited as a cause of this, gene mutations. Like the APC gene, which stands for the Edematous polyposis coli gene. This is a tumor-suppressing gene, suppressor, and mutations in this cause the cells that have gained a whole bunch of damage through DNA to not undergo apoptosis. Under normal circumstances, if you got like a whole bunch of cells here, and this one starts to get a whole bunch of damage to the DNA, eventually apoptosis will be induced and it will kill itself. With this APC gene mutation, that doesn't happen, and then those mutations continue to spread as the cell keeps to replicate, and you get little polyp formations in that area. Things like smoking, alcohol use, things that irritate the bowels too, like red meat, can also be a risk factor for this, like high-fat diets. Obesity, inactivity as well. Now, if you were to look at somebody's colon, you would see throughout little bumps and growths throughout a normal colon. That's totally fine. Some of those are what we call non-neoplastic polyps, so those things that shouldn't be or aren't related to neoplasm growth at all. But some of them are neoplastic polyps. And those neoplastic polyps, if they keep growing, so stuff like this would be maybe a neoplastic polyp, if they keep growing and dividing, they have the chance to become an adenocarcinoma, a carcinoma of the glandular tissue of the large intestine. Now, if you remember too, back to your A&P, we have these crypts that exist throughout our digestive tract. This is part of the mucosal lining of the colon. This crypt is going to be made up of cells, normal epithelial cells, and then our mucus-producing cells, those globular cells, the secreting cells. Hence the adeno portion of this carcinoma. These are cancers that arise from the glandular tissues. Now, usually colon cancers are a result of multiple genetic problems that happen, or not genetic necessarily, but multiple problems with the genetic material. Chromosome instability accounts for most of these problems. So this can be things like non-disjunction, junction of cells, where we get abnormal chromosome complements in certain chromosomes. They can be mutations that exist through replication errors, so like a point mutation, where you're swapping out the letters, an A instead of a G in a certain location as the cells are dividing. So it can be part of that mutation pathway too, or it can just be the chromosome instabilities can be parts of the genes that are inherited from our family members. So certain genes associated with like our increased tumor production in those locations. Common clinical manifestations can be things like changes in bowel habits. So whether you have like obstructions or not, or just whatever change exists, it can be increased urgency, decreased urgency, whatever is normal for you, any change there. And different parts of the colon are going to have different symptoms associated with it. So like if we draw large intestine here, so that's sigmoid colon, descending, transverse, ascending colon, and then we have the small intestine associated there. If we have problems on our right side, the right colon, usually we don't see obstruction until very late stages. So no obstruction until late stages, where this gets big enough to actually cause some blockage. This is a fairly big tube, and so obstruction in that area, not super common. However, in the descending colon, it's common to have ring obstructions in this area, and so that's pretty early stage. So location does matter as far as what type of manifestations we see. Abdominal pain, that's going to be present with most of these. You're going to be destroying tissues, so pain's going to be a part of that, obviously. Bowel obstructions, depending on when. Occult or frank blood in the stool. So if you have these masses here and they become ulcered as material is moving past, that's going to lead to blood accumulating in the stool. That loss of blood will lead to things like anemias, especially iron-deficient anemia. And that can be monitored. That can be actually one of our ways to diagnose using the presence of blood there. Diagnostic criteria for colorectal cancer. Colonoscopies, one of the easiest ways to do this, especially in older individuals that have a family history. I would even say frequent colonoscopies. This is where they stick a camera up through the rectum in through the large intestine, and they just examine for any signs of neoplasm growth. You're going to see polyps there, and that's totally fine. Sometimes those can be our pre-cancerous polyps. Looking at a complete blood count too as well, looking for types of anemias that are present. Checking for the presence of blood in the stool is also very common. There is one thing that your book mentions, the serum carcinoembryonic antigen that's used as a diagnostic criteria. It technically is, but it's not a very good one. It's pretty general and doesn't really tell us whether it's colorectal cancer or something else, but it can be used to determine different types, not specific types, but that maybe cancer is present somewhere. Sigmoidoscopy, that's the same thing, but just of the sigmoid colon, this portion right here. And then biopsying any lesions that you see in there and looking at them under a microscope, checking for differentiations. Now with colon cancers, and like with most cancers, early detection is important. If we can catch it before it starts to metastasize and spread to the lymph nodes, that's the best option. Once it makes its way to the lymph nodes, treatment is very, very difficult. In fact, I think most metastasized colorectal cancers are not curable. Once they've gone to the lymph nodes, that's kind of it. Colon treatments, first off, surgery, if we catch it early. That can be removed. If it's spread to the lymph nodes, though, you're going to need surgery plus chemotherapy. Chemotherapy can be used too for non-specific locations as well if it's spread. Biological agents to help with this. These are just substances that help to change biological pathways. You would usually use chemotherapy with those biological agents. And then radiation, if you have a localized area that you can't remove with surgery, you could go in with radiation, destroy those too, or if it's spread to lymph nodes, radiation that way as well. Again, though, this is a very dangerous type of cancer that does kill a lot of people, and partially because it's just not detected as early as it could be. So important for people who have family histories of colorectal cancer to get routine screenings, colonoscopies, checking for occult blood or frank blood in their stools, and just kind of keeping at it, changing diets if possible, reducing fatty foods, increasing fiber content. Pretty dangerous, pretty deadly type of cancer.